Welcome to Solutions for the World. Here we don't focus on the grift and constantly complain about the world's problems to keep you in a constant state of anxiety, but instead guide you on the current realistic ways to solve issues that harm the world we live in. The next problem we will discuss here has affected everyone in 2020, and that has to do with pathogens. There are many ways to fight against pathogens depending on what kind they are, but now we will focus on the 2020 pathogen, which has only been focused on really a one-way path of defeating it in the media. And that's, with a shot. Because there is controversy with taking the shot as many don't like shots, we have other solutions that haven't gotten the media attention that they deserve. The most efficient way of protecting yourself from the 2020 pathogen is by taking a substance called ivermectin, also known in the brand name form, Stromectol. This drug is found to reduce the replication process of the 2020 pathogen and is used to reduce the transmission rate of malaria because of its potential to kill parasites. Ivermectin is a very common drug used worldwide and is readily available in most countries for over-the-counter use, meaning that you don't have to have a doctor prescribe the medicine. Other conveniences of ivermectin is that the cost is very low, affordable, and you only have to take it once every 2 weeks for protection. There are very low negative side effects of using ivermectin, as it is even safe to be used by pregnant women. The only downside to this use is you may have a liquidy stool, because its main function of use is to get rid of parasites in the body, so this may be a temporary effect as your body is shedding unwanted organisms. In the United States, ivermectin is not considered an over-the-counter drug, so you will have to get a doctor that will prescribe it for you. This is unfortunate as many people have used an alternative way of getting the substance by buying versions that are used for veterinarian applications for animals. There is no recommendation of doing this, but people that have used it this way when applying the weight ratio dosage have had no reported negative side effects. Since it is slightly more difficult in the United States than the rest of the world to obtain ivermectin, there are other over-the-counter supplements that work in protecting against the 2020 pathogen. You can get quercetin, a natural supplement which is a substitute to the drug Plaquenil, in combination with the mineral zinc, help reduce the replication process, by opening up the channels to the cell, to allow the most absorption of the mineral zinc. Quercetin in a bioavailable form is more effective, if you can get access to it. Also, bioavailable vitamin C, or liposomal vitamin C is best for a strong immune system. Some have even taken vitamin C intravenously, to combat illnesses, as it seems that you cannot overdose on the supplement. In combination with all these recommendations to boost your immune system is getting enough vitamin D3 in your system, which is harder to nourish yourself in the winter seasons, since there is less sunlight that the body uses to naturally produce vitamin D. You can enhance the absorption of vitamin D3 with vitamin K2 in combination to get the best results. The next malaria-fighting natural supplement I would recommend that helps against the 2020 pathogen is known as Artemisia annua, also known as sweet wormwood, a plant extract that has antiviral properties. Reports out of Germany and Tanzania are having benefits with using this extract, and can have enhanced results surprisingly by combining it with natural coffee blends, as it is recorded to have 3.5 times the regular effect than just using it alone. I've noticed that a lot of pathogens attack the lungs as well as the 2020 pathogen, so I would suggest getting a nebulizer, especially using it if you're having mild symptoms of infection. I have found that 4 positive treatments can be used with a nebulizer for aerosol treatment. The first one is niacinamide. The doses can range from 2 mg for mild symptoms up to 80 mg depending on how life-threatening the situation is. I would also recommend adding distilled water to provide a smooth comfort level breathing in the aerosol. There are different kinds of iodine, but the best one to use in most cases for its antiviral effects, and many other beneficial health effects, would be the monoatomic form, niacinamide. Now to the next substance, that is, food-grade hydrogen peroxide, in small doses, usually 1 to 10 mixture with a saline solution. That would be 1 drop to every 10 drops of saline water in your nebulizer. Hydrogen peroxide naturally occurs within the body as a defense mechanism against pathogens on a nanoscale model. It is known that vitamin C changes into hydrogen peroxide your body can use, for immune defense purposes. H2O2 is known as an antiseptic, antimicrobial agent, that destroys pathogens. Next in line for nebulizing treatment, is a nanosilver solution which has particles of silver molecules suspended in distilled water. This technique was discovered and promoted by Dr. Bob Beck, who has other amazing treatments for various ailments we will discuss in the Part 2 series. The solution for nanosilver works best the smaller the particles are, and is referred to as ionic. Silver is a known pathogen destroyer, and that is why it is used in many industries. The last medicine good against the 2020 pathogen to be used either in an inhaler or nebulizer are corticosteroids. This therapy is shown to improve the odds or survival of patients who are critically ill. This obviously is to be used in severe cases and applied with medical discretion with a doctor's prescription. Corticosteroids do not directly attack like silver, or reduce replication like the other preventions and treatments mentioned earlier. Instead, the drugs work by dampening the activity of a patient's immune system, to prevent it from attacking the lungs, a serious and often fatal condition called acute respiratory distress syndrome, or ARDS. This would be ideal for all those who don't want the shot, and instead want prevention and reduction of any symptoms for the entire world. Problem solved. If you have anything you want to discuss, then feel free to debate in the comments below. If it turns out the information you provide is valid, I will make sure to do an update video later. Please check out our Part 2 series on medical solutions. Also, you can donate to our cause to solve the world's problems. Remember, you can change the world if you really want it.